Classmates, today we will study the trigeminal nerve and facial nerve. The trigeminal nerve is the largest mixed cranial nerve, containing both general somatic sensory and special visceral motor fibers. Its special visceral motor fibers originate from the motor nucleus of the trigeminal nerve in the midpons, form the motor root of the trigeminal nerve, exit the brain at the junction between the basal part of the pons and the middle cerebellar peduncle, lying infromedial to the sensory root, and finally enter the third branch of the trigeminal nerve, the mandibular nerve. They exit the skull through the foramen ovale, follow the branches of the mandibular nerve, and distribute to the masticatory muscles, among others. The motor root also contains fibers from the mesencephalic nucleus of the trigeminal nerve, mainly conveying proprioception from the masticatory muscles. The trigeminal nerve is predominantly composed of somatic sensory fibers. The cell bodies of these fibers are located in the trigeminal ganglion, also known as the semilunar ganglion. This ganglion lies in the middle cranial fossa, in the trigeminal impression on the anterior surface of the petrous part of the temporal bone, and is enclosed by a dural pouch called Meckel's cave. The trigeminal ganglion consists of pseudounipolar neurons. Their central processes converge to form the large sensory root of the trigeminal nerve, which enters the brain at the junction between the basal part of the pons and the middle cerebellar peduncle, and terminates in the sensory nuclei of the trigeminal nerve. Among these, fibers conducting pain and temperature mainly terminate in the spinal trigeminal nucleus. Fibers conducting tactile sensation mainly terminate in the pontine nucleus of the trigeminal nerve. Principal sensory nucleus. The peripheral processes of the cells of the trigeminal ganglion form three major branches. The first branch, ophthalmic nerve, the second branch, maxillary nerve, and the third branch, mandibular nerve. These three major branches further divide to distribute to the facial skin, eye, and orbit, mucosa of the oral and nasal cavities, paranasal sinuses, teeth, meninges, etc., conducting various sensations such as pain, temperature, and touch. The ophthalmic nerve contains only somatic sensory fibers. After arising from the trigeminal ganglion, it passes through the lateral wall of the cavernous sinus, lying inferior to the accompanying oculomotor and trochlear nerves. It then enters the orbit through the superior orbital fissure, and its branches distribute within the orbit to the eyeball, lacrimal apparatus, conjunctiva, dura mater, mucosa of part of the nose and paranasal sinuses, and the skin of the forehead, scalp, upper eyelid, and dorsum of the nose. The maxillary nerve contains only somatic sensory fibers. After arising from the trigeminal ganglion, it enters the lateral wall of the cavernous sinus, runs forward along its lower part, and exits the skull through the foramen rotundum. It enters the upper part of the pterygopalatine fossa, continues forward through the inferior orbital fissure into the orbit, where it continues as the infraorbital nerve. The maxillary nerve mainly distributes to the maxillary teeth and gums, mucosa of the roof of the mouth, nasal cavity, and maxillary sinus, part of the dura mater, and the skin between the palpebral fissure and oral fissure, receiving sensation from these areas. The mandibular nerve is the largest of the three major branches of the trigeminal nerve. It is a mixed nerve containing both general somatic sensory fibers and special visceral motor fibers. After exiting the skull through the foramen ovale, it divides into anterior and posterior trunks deep to the lateral pterygoid muscle. The anterior trunk is small, besides giving off muscular branches to the masticatory muscles, tensor tympani and tensor veli palatini. It also gives off a buccal nerve. The posterior trunk is large. Besides distributing branches to the dura mater, mandibular teeth, and gums, mucosa of the anterior 2/3 of the tongue and floor of the mouth, and skin of the auriculotemporal region and below the oral fissure. It also gives off branches to innervate the mylohyoid muscle and anterior belly of the digastric muscle. Next, let's study the facial nerve. The facial nerve is a mixed cranial nerve containing 4 types of fiber components. Special visceral motor fibers originate from the facial nucleus in the tegmentum of the pons, mainly innervating the muscles of facial expression. General visceral motor fibers originate from the superior salivatory nucleus in the pons. Are preganglionic parasympathetic fibers. After synapsing in the corresponding parasympathetic ganglia, the postganglionic fibers distribute to the lacrimal gland, submandibular gland, sublingual gland, and mucous glands of the nose and palate, controlling their secretion. Special visceral sensory fibers, i.e., taste fibers. Their cell bodies are located in the geniculate ganglion, within the petrous part of the temporal bone at the bend of the initial part of the facial canal. The peripheral processes distribute to the taste buds on the anterior 2/3 of the tongue. The central processes terminate in the upper part of the nucleus of the solitary tract within the brainstem. General somatic sensory fibers convey somatic sensation from the skin of the ear and proprioception from the facial muscles. The facial nerve consists of 2 roots. The larger motor root emerges from the brain at the cerebellopontine angle, at the lateral part of the pontomedullary sulcus. The smaller mixed root, also called the intermediate nerve, emerges from the brain lateral to the motor root. The 2 roots enter the internal acoustic meatus, merge into a single trunk, pass through the fundus of the internal acoustic meatus, and enter the facial canal, which is adjacent to the tympanic cavity. It first runs horizontally, then descends vertically and exits the skull through the stylomastoid foramen. It then passes forward through the parotid gland to reach the face. At the beginning of the facial canal, there is an enlarged geniculate ganglion. Next, let's look at the branches within the facial canal. 1. Chorda tympani arises within the facial canal, about 6 mm from the stylomastoid foramen. It passes through the tympanic cavity and petrotympanic fissure to reach the infratemporal fossa. It runs antero-inferiorly and joins the lingual nerve, a branch of the trigeminal nerve, and follows its distribution. The chorda tympani contains 2 types of fibers. Taste fibers follow the lingual nerve to distribute to the taste buds on the anterior 2/3 of the tongue. Conducting taste impulses, parasympathetic fibers enter the submandibular ganglion below the lingual nerve, synapse there, and the postganglionic fibers distribute to the submandibular and sublingual glands, controlling their secretion. 2. Greater petrosal nerve, also known as superficial greater petrosal nerve, contains parasympathetic secretory fibers. It arises from the facial nerve at the beginning of the facial canal, exits through the hiatus for the greater petrosal nerve on the anterior surface of the petrous temporal bone, runs forward through the foramen lacerum to the base of the skull, where it joins the deep petrosal nerve from the internal carotid plexus to form the nerve of the pterygoid canal. It passes forward through the pterygoid canal to the pterygopalatine fossa and enters the pterygopalatine ganglion. The parasympathetic fibers synapse in this ganglion, and the postganglionic fibers follow some branches of the ganglion and branches of the trigeminal nerve to reach the lacrimal gland and glands of the palatal and nasal mucosa, controlling their secretion. 3. Stapedius nerve. Innervates the stapedius muscle in the tympanic cavity. Extracranial branches of the facial nerve. After exiting the stylomastoid foramen, the nerve immediately gives off several small branches to innervate the occipital belly of the occipitofrontalis muscle. Muscles around the ear, posterior belly of the digastric muscle, and stylohyoid muscle. The main trunk of the facial nerve then runs forward, enters the parenchyma of the parotid gland, where its branches form the intraparotid plexus. Branches from the plexus emerge radially from the border of the parotid gland and distribute to the various facial expression muscles. Extracranial injury to the facial nerve, affecting the somatic motor fibers, manifests as facial muscle paralysis, disappearance of forehead wrinkles on the affected side, flattening or disappearance of the nasolabial fold, deviation of the mouth angle to the healthy side, inability to puff the cheeks or whistle, and absence of a corneal reflex, damage within the facial canal. In addition to the above manifestations, also includes loss of taste sensation in the anterior two-thirds of the tongue, and secretion disorders of the lacrimal gland, submandibular gland, and sublingual gland. Next class, we will begin studying a new chapter.